Good evening, everyone, and thank you again for tuning in to another episode of ParentTown TV. Today, I have Dr. Goh Ping Ping here with me, who's the medical director of the Singapore Heart Foundation, and we're going to be talking about something that's really interesting. It's about cardiovascular diseases and basically heart diseases, and how you can prevent a heart attack. So, a lot of moms here are not aware of the fact that cardiovascular diseases is the number one killer among Singaporean women. And to me, the moment I read that, I was completely shocked and just absolutely horrified about it. And I felt like we need to do a ParentTown session about this, and everyone needs to start talking about this. So, Dr. Goh, how long have you been involved with the Singapore Heart Foundation?
More than 10 years. Yeah.
Okay. And Dr. Goh, maybe we can talk a little bit about yourself. So, you're a mom.
Yes, I'm a mom with 3 children. My eldest is in the national service now.
Okay.
He's 20. And my youngest is doing her PSLE.
Okay, so that's a
yes.
huge age gap, 12
Quite
to 20.
a big age gap. And I have a 16-year-old.
Okay.
Yeah.
And are they boys, girls?
Eldest is boy, and middle and youngest are girls.
Okay. And so, in your family, do you have any history of cardiac arrests or heart diseases or?
Not in my own family, but I do have other relatives, more distant relatives, as well as, of course, friends and colleagues who have suffered from heart disease.
So, do you feel that from your on-ground activation, do you think that a lot of people are aware that heart diseases is such a rampant problem here in Singapore or around the world?
Oh, well, I think people may have some big idea, as they may have known of someone maybe at work, who has so-called collapse from cardiac arrest. They may know of people who have gone for like treatment like stents or bypass surgery. But I think on the whole, most people probably do not think of themselves as being at risk.
Mm-hmm. So, like this common perception that heart diseases is an old people's problem. Is that true?
Yes, I think you are right. Most people think something is something quite remote that some people get when they grow old, and that's how they pass on.
Mm-hmm.
Yes, yeah, I think so. But we do see more and more in our own medical practice that younger people are suffering from heart disease.
So would you say that it's kind of age agnostic in that sense?
Well, it is still age related,
Mhm.
but perhaps from our current lifestyle and certain stress and maybe lack of opportunity to be physically active, I think people are suffering from these diseases at a younger age.
Okay. So for all of those who are tuning in right now, we're talking about heart diseases on ParentTown TV. I'm sure by now you know the drill. Ask your question live on ParentTown, and we will have Dr. Goh answer it right now. And if Dr. Goh doesn't manage to answer it, we will make sure that someone from the in-house team answers your question, so there's no unanswered question on ParentTown. So Dr. Goh, I'm going to go to some of the questions that the moms have been sending us.
Yes.
And so the most upvoted, the most loved question right now is from a mom called Arthi. And she says, I delivered post 30. I'm also a working mom, so I feel like I'm perpetually stressed, trying to strike a balance between raising my toddler and work pressures. Am I at risk for heart ailments?
Well, anyone who is under long-term stress, they are prone to various problems, medical problems, some of which are related to or can lead on to heart disease. Certainly, we know that stress predisposes to high blood pressure, to irregular heartbeats, and also people under stress, they may tend to say overeat. They put on weight because of that, and this leads to other problems like diabetes and other obesity-related things. So all this, in a way, yes, they do contribute to heart disease in the long run.
Okay, so we always talk about how stress contributes to heart diseases, but is there any practical tips on how to reduce stress?
Yes, there are various tips that a lot of times I tell my patients. Firstly, dealing with the stress in a more like practical way, as in like pace yourself out in doing the things in your everyday life, and don't try to like pile a lot onto your plate. Give yourself little breaks in between. Do something physically active to take your mind off the stress, and at the same time, get a good workout. I think these are some of the ways.
But so Dr. Goh, you're a mom and you have 3 children and you're a working mom. So how do you deal with stress? Because I'm sure our audience can relate to that as well.
Well, I mean, I think I had my fair share of stress. I think don't be afraid to ask for help, be it from your spouse, from your family members, from your domestic helpers, and also I think we need to manage our own expectations and not to like be too harsh on ourselves. And I think personally, one of the ways I de-stress really is through exercise, and I find that it's a great way to do it.
Okay, so exercise, mommies. The next question is from Mom Avantika, who asks, is it true that the symptoms of a heart attack appears much before it actually happens?
Okay, that is actually quite variable, because we know that some heart attacks are silent, which means that some people may not be even aware that they had a heart attack until they have symptoms from complications. But some heart attacks, I would say, there is symptom right at the very onset. So I think symptoms that people need to be aware of primarily is chest pain. So if if you experience chest pain, chest discomfort, even like feelings of indigestion, that is something that doesn't normally occur to you.
How different is it from like heartburn?
Well, sometimes heart symptoms can feel like heartburn. So I think if there's something that is unexplained something that is very new and occurs out of the blue, something that like distresses you, then I think don't be afraid to get it sorted out. Either by seeing your doctor or at least trying to get some medical attention. Yeah.
Okay. So basically, it's not all doesn't always have symptoms, and sometimes it could just be completely silent.
Yes, that's possible.
Okay. Mummy Misa asks, are young children susceptible to heart attacks?
Well, by and large, because heart attacks occur because arteries undergo narrowing over time. So this is something that does take years to develop. So it doesn't occur in young children. We may have heard of young children, say, suffering from cardiac arrest, primarily due to certain inborn problems rather than arteries of the heart. I mean, disease of the arteries of the heart that lead to heart attack.
Are women more at risk of heart attacks than men?
Well, before the age of menopause, women are actually at lower risk compared to men, because they have protective effect on the heart from estrogen, or the female hormone. But after menopause, then the risk of women actually catch up with that of men. So they are equally susceptible after menopause.
Okay. So moms, don't just focus on yourself, but do focus on your own moms as well, because they're probably at a slightly higher risk.
Yes, certainly.
Okay. We've got Sinsu Chu asking, when should a healthy individual with strong family history of cardiovascular diseases, example, heart attack, hypertension, etc., start getting screening tests done? And what should the tests be?
Yes. Well, if there is a strong family history of heart attack, definitely by the age of 40, by the latest, you should actually get yourself screened. One useful way also is to look at your family history and look at the age of the individuals who have suffered from heart attack. So that gives you an idea also, because uncommonly we do come across people who really early, who have really what we call premature kind of heart disease. So these people may then need to be screened even before the age of 40. As far as the screening tests are concerned, it is important to screen for firstly risk factors of heart disease, including blood pressure, the blood cholesterol level, blood sugar level, and then also some tests to assess whether disease is already present in the heart, and the commonest being that of a stress test using a treadmill exercise machine.
We've got Tan Cheng Ling, who's just asked, sometimes due to the stress to manage family, work, and children, I experience breathing difficulties. Is this a symptom that I could be at risk?
If the symptoms are exclusively precipitated by a certain type of emotion, that's something that readily goes away as soon as the situation resolves. I think that is quite unlikely to be due to heart disease. But if you do find that symptoms persist, even though the acute situation has settled, or if you start getting symptoms, say, at other times when there is no actual precipitating factor, then I think you should seek medical attention.
Okay. We've got Mother Nat asking, does men and women have the same symptoms?
The commonest symptom for both sexes is chest pain, but we know that there are also so-called atypical symptoms, including breathlessness, irregular heartbeat, even feeling like indigestion or tiredness. And these so-called atypical symptoms actually tend to be present more in women than in men.
Okay.
So it sometimes makes the diagnosis for the ladies a little more challenging. Yeah.
Okay. We've got Pavin who's asked, what are the risk factors you can control to lower the chances of having a heart disease?
Well, the risk factors that we can control, firstly, screen for, and if there is high blood pressure, to treat the blood pressure with the appropriate medication. If there's high cholesterol or high sugar level, to get this under control. One big risk factor is cigarette smoking. So, to quit smoking, that is one of the ways to.
Okay.
And of course, an active lifestyle, regular exercise, a sensible diet. Yeah.
Talking about diet, we've got Mommy Rose here who's asked, are there foods I can eat to reduce my risk of a heart attack?
Yes, certainly. Foods that are low in salt, low in sugar, and low in fats.
Oh no, that sounds horrible.
And more fibers.
You know we're in Singapore, foodie nation.
Yes, but on the whole, those are the things we need to watch out for.
So should we stay away from our favorite nasi lemak and roti prata?
Personally, I feel that it is good to do so-called healthy versions of the foods that we are familiar with. So we need not stay away, but I think we can do healthier versions.
Okay, so don't use as much coconut milk.
Yes, don't use not too much salt for the seasoning, and to include foods with more like fibers, more protein based rather than carbohydrates.
Okay.
And fresh foods instead of foods that are preserved.
Okay. So Dr. Fessa, what's your favorite? What's your favorite food on this list that you should be avoiding yourself?
Food to avoid?
Mm-hmm.
I think it is like a chicken rice.
Okay, you are truly a Singaporean.
Yeah.
So we've got Mom Samantha who's asked, I've heard of people leading healthy lifestyles or eating a good balanced diet, and yet they still get heart attacks. Why does that happen? Is there a certain way of lifestyle that increases chances of getting heart attacks?
Okay. First of all, there are what we call non-modifiable risk factors,
Mm-hmm.
which includes a person's genetic makeup. So there are some things that you may not be able to change, but certainly controlling the risk factors will help to reduce the risk even in this group of people. I think that is why even though some people are leading very healthy lifestyle, they may still be at risk. I think to have a healthy lifestyle, at least it gives you more protection than if you don't.
Are there any routine checkups we need to do even though we feel healthy?
Yes, routine checkups including checking your blood pressure, including checking the body mass index to screen for obesity or overweight problems, cholesterol levels, sugar levels. These are the basic things that we can do.
Okay. Can you die of a broken heart?
Yes, literally you can. People who have suffered a big heart attack, they
Mhm.
can have damaged heart muscles, and that can actually lead to death. Yeah.
So every time you fight with your husband or when your
Okay.
children disappoint you and you have heartbreaks, is this actually weakening your heart?
What I can say is that extreme emotional crisis can actually predispose heart problems, and it can predispose to a heart attack in people who perhaps, I think usually in people who have already have some heart disease. Yes.
So moms, you know what to do. Cut out this little segment and show it to your hubby the next time he tries to pick a fight with you. Dr. Goh, would you like to show us the model of the heart and explain to us the basics?
Yes. This actually. Oh, sorry. This is a model of the heart, and as we can see, the heart is an organ that is about the size of a fist, and it is made of muscles. The heart basically functions like a pump to pump blood that comes out from the heart and goes to this great artery called the aorta, and that gives branches to go to different areas of the body, including the brain, the kidneys, the digestive system, the limbs, and so on. So, and you can see here on the surface, actually, there are what we call arteries or coronary arteries that supply blood to the heart muscles, because the heart muscles need blood and oxygen to function. So, if someone has heart disease, this means that these arteries can get blockages, and certain areas of the heart muscle will suffer from lack of oxygen and may even result in permanent damage.
Great stuff. Doctor, do you have any last advice for our moms on how to prevent heart attacks?
I think, enjoy your family life, your children. Take things easy and always think on the bright side.
Okay. And of course, eat healthy.
Eat healthy, exercise. Yes. Yeah,
and reduce stress.
Yes.
Thank you so much for joining us today. And for moms, if you'd like to find out more about healthy lifestyle, you can always visit the Singapore Heart Foundation's website. And is there any other materials or things that they can read about online?
Yes, actually, there is a lot of information from the Singapore Heart Foundation website. And I think please go to our website and look at the information there.
So again, thank you so much for tuning into ParentTown. And thank you again, Dr. Goh, for joining us here today.
Thank you very
And
much.
we'll see you again on Thursday when we do our next session on baby-led weaning.